Hello and welcome to What's Brewing in Education. My name is Scott Kuykendall and I am the Stanislaus County Superintendent of Schools. In this two-part series, you will learn about an innovative program called Seity Health and the Lifeguard Initiative at SCOE. We know that students are struggling with mental health and teachers are experiencing burnout, so it is essential to address it. The Lifeguard Initiative is a program geared to supporting both students and school staff. So whether you are a parent, community member, or district superintendent, you are sure to find out how this program is helping local students. With me today is Dr. Sam Romeo, one of the founders of Seity Health. Super excited to have Dr. Sam Romeo as part of this conversation. We're going to be talking about student wellness, and actually wellness has been on our minds here at the county office for quite a while. We had you and your partner, Dr. Chris Hawley, come and talk to us back in 2019.
Yeah, years ago.
And this was simply about an employee wellness program, because at the time our employee wellness program was basically just a month.
Yeah.
It was in February. We really wanted to make it something that was year-round. We wanted it to be more engaging, and we really wanted more of our employees to participate. So we had you guys come in and talk about your wellness program that you've had going on now for years. And at that time, you were talking about core values. You were talking about this whole paradigm shift of what's right with you. And I remember asking you, I think it's right around the middle of your presentation.
It was earlier than...
Was it? Okay.
Yeah.
Okay. It seemed like
I don't know, fourth slide.
Anyway, I was like, hey, this sounds incredible. Do you have this for kids? And you said...
No, actually, we don't. But we'd love to build something with you. And that's really where this whole thing started.
Right. And actually, so we did adopt the Seity Wellness program for our employees, and since then we have been partnering and working together to create a program for students.
Yeah, you all had a very different, we've presented this a lot over the years. One of the things that we noticed very early on, it might have been the fourth slide, I'd have to go check that, but it might have been early enough. We noticed very quickly that your whole team just got the concept of whole person health. And usually we're teaching a paradigm, and people are still thinking about certain parts of it, but that was what was fun for us, and it was so much alignment so quickly, is from all aspects of your committee, your wellness committee, people started asking questions, and it was just like this super synergistic dialogue and experience that really blossomed into what we're talking about.
Yeah. We've got great folks at the county office, and a lot of innovation, a lot of creativity, I would say. But we know that this whole idea of employee wellness, student wellness, mental health, this has been something that was an issue prior to the pandemic. And even when I was talking to you back in 2019 and inquiring about, hey, do you have this for students, is because even at that time, we already knew that this was absolutely an issue that was needing to be addressed. A lot of our schools were already implementing programs around social emotional learning. They're bringing on professionals, mental health clinicians. They're really utilizing their counselors as much as possible, because it was an issue then. And then what we've realized is this pandemic has actually exacerbated the whole problem. And we know that this is going to be a long-term issue. We know that simply, and we all hope that we get back to normal sooner than later, but we know that once we're not dealing with the day-to-day crisis of the pandemic, that this issue of student mental health is going to be with us for nearly a decade, potentially.
Yeah, there's we don't have the longitudinal data on COVID, obviously, hasn't been around that long. But when you look at the psychological research on what happens to people, and in particular student-age kids under social isolation, it triples their risk of anxiety and depression for 9 years after social isolation ends. So when we were talking about this early on during the early phase of the pandemic, when we had no idea how long this was going to go, we were able to talk about that. We said, even if we was the middle of 2020, even if this ends right now, we've already been enduring months of social isolation. Kids have been cut off from their peers. They've been cut off at very challenging times developmentally in their lives. And that risk isn't going anywhere. The solution, you knew this as we talked about it, the solution wasn't just going to go away with just opening schools. That was not enough. We knew we had to do more, and something that would continue to offer support as this whole problem kept evolving from not just an acute COVID crisis of the day, but this crisis of the decade of mental well-being.
And we also know, too, that it's not only our students, obviously, that are being affected, right? We're all affected by this. And when you start looking at what are the safety nets for our students? So you look at, okay, well, I mean, our teachers are there to support them. They're there for them. But how are our educators doing? When you're looking at some of this data as far as, well, how are they doing as far as their own mental health, stress levels, depression levels, and then looking at another safety net, you're looking at actually, well, what's home life look like, right? How are the parents and guardians of our students coping with this pandemic?
Yeah, one of the early studies in COVID last year in 2020 showed that across the United States, the mental health crisis for adults, for the parents supporting the kids who were going through this, tripled from 8% to 27%. And we saw the substance abuse issues in homes with parents go up to as high as 40%. So it's staggering data. So we're looking at this. We had to literally go back to sources and say, is this really happening at this amazingly accelerated rate? The answer is yes. That's the home lives that the kids were coming back to as well. So yeah, you're right.
And we've seen it, from an educational perspective. I mean, we've seen, record retirements. We've seen extreme, teacher burnout. With a lot of the shifting from, online learning to hybrid to, our instructors, our teachers are being asked to do a tremendous amount and to, can constantly adapt to all of these things. And then, one solution that I think a lot of people kind of latched onto early on was, well, maybe we can just hire more healthcare professionals to serve our students.
Yeah.
I mean, is that a viable solution?
I mean, just think about it. If we're always handing people paper towels when there's a spill on the floor, and we just need more paper towels, and there's the water still pouring out all over the floor, and we hand more paper towels, and that doesn't work. We hand a towel, and then we hand a beach towel, and we hand a blanket, and we keep doing this thing. If we don't get to the pipe and turn the pipe off, it's just going to keep doing this. We can't keep up with the paper towels. We can't clean up all the messes that are happening. We can't do it fast enough. And as a doctor, we know that in our clinics. As much as half of our clinical practice and our primary care practice is behavioral health issues. More than 3/4 of it is related to lifestyle, just in general, lifestyle. So we experience this all the time. We have similar rates of burnout in healthcare. We can't hire enough people to clean up all of the challenging things that are happening. There just isn't a way to do it. You can't hire your way out of it. And the data on that from a mental health is actually even worse, especially in California. So the data in California is we have about 26% of the behavioral health clinicians needed to address the problem that we have now. And we know the problem's worsening. We also know that a very high rate of the behavioral health clinicians are actually starting to age out themselves. They're close to 80% burnout, and almost more than a third of them are over 60. We're not backfilling fast enough to do that. So no, the short answer to your question is we can't hire our way out of this. We just can't do it. There's not enough people that actually do that as the only approach. It's not that we shouldn't be hiring people. It's not that we shouldn't be providing these services. We have to, but there's no way to keep up with how many more problems are coming in than we're actually solving.
So you bring up a really interesting point in that there are multiple solutions as we're moving forward with this pandemic when we're talking about student mental health, right? I mean, obviously, healthcare professionals, counselors, boots on the ground, teachers, all those touch points, that offers a real solution. Our schools are also doing a lot with, MTSS, PBIS. I mean, there's a lot of different initiatives going on that really look and address that social emotional learning piece that does that. What I really appreciate about this particular program, and we'll get to that here momentarily, is the way that this has been created. You can actually measure the effectiveness of any given program. So if you're a school district and you've got 5 different initiatives that you are currently implementing in order to address this problem of student mental wellness, then you actually have a way then that you can go back and you can look at the data and see, like, well, which of these are working, which ones maybe aren't, which ones are more effective, which way should I lean moving forward. So we actually have an objective way, quite frankly, to really look at this whole idea of student wellness moving forward.
Yeah, I think that was one of the things that you called out early in our discussions, and your whole team did this, is that there's a lot of amazing and important work being done across the board to stem the tide and to address the mental health crisis. There's a lot of great work. And that work isn't to be replaced, it's to be augmented with systems that actually support people to do their jobs more efficiently. We're asking people to do things, from teachers to clinicians to behavioral health specialists to school psychologists to support staff. We're asking people to do an impossible task without the tools to do it. And so as we are early in our discussions, we talked about, well, what's one of the tools that you need? Is it working? Simple question. I mean, if you're a coach in sports, like, are you winning? Are you losing? Is your team happy? Are they inspired? Like, there's simple metrics that we use. Our disease model of healthcare is actually really, it's easy when you take wellness and you say, let's put something else that everyone understands. If I was talking about a diabetes clinic right now, we'd say, well, how do you deliver a diabetes clinic? Well, you need educators. You need people to help with lifestyle. You need people to teach people how to measure their sugars at home. We need clinics that can take care of people and support people and optimize their health. There's all these pieces. And if you don't have each one of those pieces, you can't actually get ahead of that problem. Well, traditionally, and what we've had historically in wellness there's been no measurement to see or anything we're doing helpful. So we needed the lab test. And there's like the sugar check at home. I can do that every day, and I can see my daily fluctuations. Then I go in the doctor's office every 3 to 6 months, and I do a different blood test that says, oh, how's your average been for these last several months? We kind of followed a similar model in our construct as we were devising this whole system to say we need a way for people to regularly measure their day-to-day fluctuations, but also kind of a bigger look at what they're averaging, so that all the initiatives that all the people were doing on that team, both from their home life to their support team, could have an idea, okay, what's working, what's not. And so, yeah, that's exactly what we did. We built the tool just like that.
Okay, so let's actually talk more about the tool. Let's talk about Seity and kind of what it is that makes up kind of the core content, right? What kind of makes this thing tick?
Yeah, this is fun to talk about for us now because we've been doing this for almost 20 years. So when you've made enough mistakes, it kind of seems like you've done a really good job, but along the way you just whittle and correct and course correct and keep working at it. What we knew going in, this is 20 years ago, and we were docs down at the Romeo Medical Clinic in Turlock, and we were slugging away in the trenches like other docs and primary care docs were, and we realized very quickly that we were body experts taking care of humans. And what does that mean? Well, we had all this 12 years of medical training to just take care of a person, and a person has all these aspects about them. But we are trained about how to address their body concerns. So you learn really quickly in practice that people are so much more than just a body.
So what other aspects?
That's a great question. Well, let me tell you an example of it. So someone comes in with a migraine and they just lost their job and their kids are leaving the home and they just lost their dog, and now a pandemic hits And do they likely have a brain tumor, or could it be a lifestyle problem? They could have a brain tumor, and I'm really glad we have neurologists and we have scans and things to determine that. But the likelihood in that scenario is that that's a life problem. So we had to devise a way. Well, first of all, we looked for solutions that would account for the whole spectrum of what it was to be human. Like, if we had this body lane really dialed in with years of experience, like, what's the rest of this look like? And so we just went to the literature, and there is aspects in our world that affect our health. There are aspects of our body, of our mind, and of our spirit. And then there was this deeper layer that we kind of discovered through the years, that even beyond that spirit layer was this identity, this something that's uniquely me, something that just resonates when I'm living out the life that I'm supposed to live as an individual, and then something that doesn't when it doesn't. So in each of those world, body, mind, spirit categories, which that's not a new concept. I mean, that's holistic thinking, and that language has been around. But when you drill down into the evidence of each one of those, we actually really codified that there's 18 subcategories that we're juggling every day in our lifestyle. And not the uncontrollable ones, the controllable ones, things that we can actually choose. Like an uncontrollable one would be like the weather today. We can't control the weather. We can decide what we're going to wear in the weather. We can decide if it's raining, if we're going to bring an umbrella. So uncontrollable is the weather, controllable is what we do with it. We codified 18 different areas of our life and that we can actually control that fit into this model of a world, body, mind, and spirit model. And then the next thing we really discovered after just iterating years of this in our clinical practice, and our laboratory was really taking care of patients and refining our thinking and what was working and what wasn't working. What it really boiled down to actually is just 3 simple questions. So who are you? Who are you, Superintendent Scott Kuykendall? Mm-hmm. Who are you, uniquely you? What are you doing in your life? And how's it working out for you? So
say that again.
Yeah, so it's like to get someone from wherever they're at some point in their health and on their life journey, to get them from a place where they're at to a place that's more optimal, or a place of wellness, their best version of them. They needed to know who they were. Everyone needs to know this. Who are you? What are you doing in your lifestyle and the things that you can control? And how is it working out for you? So that's really, those 3 things came down, and then we built systems and processes under each one of those, and that's what the Seity program is. And Seity actually means, the name Seity, which is S-E-I-T-Y, Seity actually means a unique expression of self. So it really started, it doesn't mean the world revolves around you, but you start with you, and you need to be authentically you and live that out to its fullest potential to do your best work in the world. And that's what those questions really are the map towards.
Right. And I know that for our employees, because we rolled this with our SCOE employees first, it has been hugely successful. I mean, our adoption rate is now around 70%. And again, this is completely voluntary, right? So people are absolutely finding that this is helpful for them, it's beneficial for them. And I know that one of the things that people most like to talk about are those core values. Yeah. So can you talk a little bit more about the core values and kind of within the Seity platform, like how do you determine what your core values are?
It's a great question. That first question, who are you? When we started trying to answer that question, the who are you question, we did what most doctors do. We just went to the literature and it's like, oh, someone else probably figured this out. Where's a tool that we can use? Where's an instrument? And most of the road kind of stopped at personality tests. There's lots of things in that space. There's Enneagrams and there's Myers-Briggs and there's Disney princesses. There's all kinds of things.
We'll probably get to those later with Dr. Chris. Yeah.
Oh yeah, yeah, it's great. So there's all kinds of little tests that give you little windows into attributes about yourself and strengths about what your assets are and those types of things. But those aren't uniquely you. We found that those, while they can describe you well and predict some of your behavior, it's not at the deepest level what inspires you and gives you meaning and purpose. So as we bumped into, and again, this is over years, as we bumped into the limitation of what was historically defined as what it was to be you on the personality level, we kept digging deeper, and we realized we had to get to the values that are unique in each individual. So we looked for tools, and there's some esoteric tools, a couple that have been even globally studied in multiple cultures, but they were research-based psychology tools. They were instruments for psychology research that had no capacity to really apply in a population way that was accessible. We just didn't have that. So we started building it, and we built a tool, and it was this core value tool. And essentially, in this process, I'll just cut to the chase. You go through a series of sorting, kind of this negative filtration system. What am I not? What am I not? Choose, choose, choose. It's in about 6 minutes, you end up with your 4 unique core values. And when I say unique core values, the likelihood of you and I having the same set of core values in the same order of priorities is 1 in 37.9 million using our tool. So we're truly unique. As a doctor, as an educator, you're not likely to see the same student in the same collection of values more than once in your lifetime. As a clinician, as a doctor, I wasn't likely to see the same patient with the same core values. So knowing very quickly what the core values were for that individual gave us some really important things. The first thing it gave us is this is their unique source of inspiration. If they lived it out, this is what would give them meaning and purpose. It's an essential part of establishing well-being with people. So that's one thing it gave. The other thing that it really did for us is it flipped the script. We are suddenly talking about, instead of our patients being things, almost disease states, like these are the things that are broken and let's fix you. It's a broken model. Let's fix what's broke. It was, this is what's amazing and unique about you, and how can you live that out? So if you think about that paradigm shift, which is a really important one, fix what's broken or start with what's right with you and live that out. This is universal, and this helps everyone live their best life. We needed that tool. Now, for us to come up with a cool little sorting tool, whatever, big deal, right? We had to actually validate that it was actually meaningful. So we started a collaboration with the clinical psychologist in Cal State Stanislaus and a team of researchers, and said, scrutinize us, help us. And there were actually there's tremendously positive feedback. And so part of the iterations along the way were them refining our instrument. So we had done some things. There were some blind spots in our instrument that we weren't taking care of very well. And through those collaborations and through all of that scrutiny, our own scrutiny, we put ourselves through the ringer on this. We came up with this scientifically valid instrument where we can discover that unique set of core values in about 6 minutes and then start from a place where people start to live that out.
So I remember specifically back in 2019, you were talking about core values, and you were talking about how everyone is unique and what is right with you. And that is when the light bulb went off for me. It's like, you know what? As a teacher, if I knew every student in my class, if I knew what their 4 unique core values were, suddenly that would just accelerate the opportunity that I had to build relationship, have meaningful conversations, maybe think about the types of assignments, activities, my approach as an educator. So that's why specifically I remember asking, it's like, oh my gosh, this would be such a useful tool, because if I as an educator knew the essence and identity of kind of each of my students in my class, and suddenly I had that, I could just do a better job as an educator.
Yeah, your intuition was actually better than our awareness at that time, because since that conversation, which is now a few years old, when you called that out, that was just your experience as an educator, like would be amazing. We've now discovered in the psychological literature, it's very clear. Couple things. Number one is we can accelerate trust if we understand and have coherence in values. If we understand each other's values, we're actually starting from a place of respect. I mean, think about that in today's day and age, which is so polarized and in such a place of posture that we can't actually start from. It's very difficult to start from a place where, okay, you have a different opinion, I have a different opinion. Let's see what the values that's inspiring that opinion, and how can we come to this place of understanding where we can dialogue about it. Value coherence is a thing, and it's in the psychological literature, and it accelerates relationships. So that's absolutely true. One of the things that we're doing with the SCOE team right now, and we just actually are finishing our first technical paper on this, is we've looked at the data of all of the SCOE employees and looking at how much value coherence is with all of the SCOE students. And so the next phase that we're looking at is, and then down to the individual teacher layer, what's the value coherence with their actual students? Every teacher we've talked to, and you were included, has told us that there's some of those classes that you just kind of love, and there's some that are a little trickier than others.
Well, every single class, okay, so I come from a high school, so if you came from a high school or a junior high perspective, having multiple classes a day, they all have their own personalities.
Yeah.
And sometimes those personalities were absolutely congruent with you, and it was a super positive experience, and all of a sudden, next class would come in and could be completely opposite. It's like, wow, why is it that there just is this disconnect, or this class doesn't seem to get my humor, or whatever the case may be, right?
Yeah.
But there was definitely something palpable, just classroom to classroom. Like each class had their own personality, and now looking at it through a lens of core values, like it makes total sense.
Yeah, we can actually study that and look at that and look at the value coherence, and so it can be coached up. We can coach people to understand each other, including from the teacher to student population level. Like if you're a teacher that's really into tradition and respect or honor, and the students are into adventure and spontaneity, there may be a problem keeping those kids sitting in their chairs. So it may be an opportunity for this person to get out in front of that and build in some spontaneous activities in that classroom and activate the kids.
To me, that just has tremendous potential.
Yeah, it's really helpful. This helps all kinds. This helps marriages. It helps family relationships. It helps just get to the root of interpersonal conflict when you can start from a position of mutual respect and value each other's values, and then have language to bridge the difference.
Dr. Sam Romeo, thank you so much
Thanks
for
for
talking
having
with me.
Appreciate it.
It's fantastic.
Yeah, thank you.